Hello, my name is Dr. Rajan Chaudhary, and welcome to our new Second Medic web series, Ask the Expert. In this web series, we'll be joined by senior medical and surgical consultants who are experts in their field. We'll be asking them questions about their specialty, what kind of things they see, how they treat it, and what is important for the public to know about what they do. In today's episode, we'll be joined by Dr. Rakesh Rai. Dr. Rai is a senior consultant in hepato-biliary and pancreas surgery, as well as in transplant surgery. He is trained in many transplant centres around the world, including the Royal Free in London, the Freeman Institute in Newcastle, and the Queen Elizabeth Hospital in Birmingham. He has also gone for a fellowship in the United States with the American Society for Transplant Surgery at the Methodist Transplant Institute in Memphis. He has authored many papers, written a book, and been invited to speak at many conferences around the world, including in India, on transplant surgery and hepato-biliary pancreas surgery. We are very lucky to have him here with us today. Dr. Rakesh Rai, thank you for joining. Can you tell us a little bit more about your specialty?
Hi, Rajan. This is a fantastic topic of discussion today. The question which you have raised is very, very important. Hepato-pancreatic biliary surgery is relatively a new subspecialty of surgery. If you look at most of the part of the world, including developing and underdeveloped country, still HPB surgery is not a separate subspecialty, and it's practiced mostly by the general surgeon or some GI surgeons. We are fortunate in India that HPB surgery has started gaining importance in last almost a decade, and now there are units which are focusing only on HPB surgery. This is very, very important because if you see the work, especially into the research in HPB surgery and technical development in HPB surgery has happened in last these 10-15 years, and it has made a significant improvement in quality of care for these patients. So that's how the HPV surgery has evolved.
And what is it about the liver that makes it so special? Why does it deserve its own specialty?
So, if you remember your anatomy days, we studied that liver is the biggest organ in the body, but it's not only its size. If you look at its physiological function, it's so complex. This is the only organ in the body which does multiple different kind of function, which goes on 24 hours a day, 365 days a year. So it does, for example, synthetic function, metabolic function, excretory function, endocrine function. There are so many functions, and there is no other organ which can match it. And that's why it makes it very complex physiology wise. And as you will know, the structure is also very complex. It's a three-dimensional solid organ. There are so many kind of variation in its anatomy. So putting all of this together, the pathology also is so varied that's why I think if we need to go into detail, it deserves a separate place, as far as, the medical science as a subspecialty is concerned.
The liver is also unique, isn't it? It's able to regenerate, unlike many of our other organs. For instance, the skin. If you cut it, it forms scar tissue. You're able to see where the previous injury was. With a liver, it becomes like new. Are there any conditions where this doesn't happen?
So, you rightly said this is a very, very unique property which liver has, which is regeneration and all a complete regeneration, most of the time. And that's why we can always take out the part of the liver for the tumor or any other disease. But unfortunately, this does not happen all the time. There is a limit for regeneration to the liver. So if you see, I'll give an example. If you have some kind of a drug poisoning, for example, the most common thing is paracetamol, it causes a sudden and severe insult to the liver. So imagine if you suddenly within, hours to days, if you destroy all the hepatocytes, then liver loses its capacity to regenerate. And in that scenario, liver is not going to regenerate and patient will go into what we call as acute liver failure. And similarly, there are other circumstances of chronic liver damage, which goes on for days to weeks to years, where the damage is slow but persistent. So the liver tries to catch up, liver tries to regenerate, but what happens along with the hepatocytes differentiation and proliferation, the fibroblasts also proliferate, a lot of fibrosis happens, then the liver becomes nodular and becomes hard, and liver loses its character, it becomes very very hard, causes portal hypertension, and as well as the function declines, and that's what we call as chronic liver dysfunction, chronic liver disease, or cirrhosis. So these are the two circumstances where although the liver has got power of regeneration, but it fails to compete with the insult which it gets, and unfortunately liver fails.
So we know that alcohol can cause problems with cirrhosis, and we know there are some viruses like hepatitis that can also cause issues. Are there any other conditions that are becoming more and more prevalent that people may not know about, but actually has a big impact on your liver?
Yes, as you rightly said, the commonly we come to know about alcoholic liver disease, alcohol causing cirrhosis. We hear about certain hepatitis viruses causing cirrhosis, but there are so many other causes of liver cirrhosis. But I'm going to just focus and highlight for the people listening to us that one of the epidemic which is almost developing whole of the world is a disease where the liver gets damaged by deposition of fat. So everybody's liver has got certain amount of fat, but when the excessive fat starts developing and getting deposited in the liver, this deposition of fat finally is going to start producing inflammation, leading to injury, leading to scarring, and finally leading to cirrhosis and chronic liver disease. And this is called a non-alcoholic fatty liver disease progressing into NASH, which is non-alcoholic steatohepatitis, leading to cirrhosis. So this is just has been just spreading, and this is spreading all over the world just because of the change in lifestyle, even in the developing countries. So earlier we thought that this is a disease of only the developed country, which is related to obesity and overeating and the fatty food. But even in India, we see a lot of NASH related cirrhosis, and the patient may not even be obese. So this is a very, very dramatic change in epidemiology of this chronic liver disease, and it's really worrying.
Now, with viruses, can you give us a little bit of an explanation about what they are and how it has an effect on the liver and what we should do to protect ourselves?
Now, as we are surrounded by viruses in our atmosphere, and there are so many different kind of viruses, starting from common disease which people know, like common flu, which is also caused by a virus. But when we are talking about the liver, we are talking about certain group of viruses which, when they enter into blood, they prefer to get deposited in the liver, and slowly they can destroy your liver. So the common viruses which we describe is hepatitis A, B, C, D, and E. These are the viruses which prefer to sort of get into the liver, and they cause the liver damage. Now, among them, there are two groups which we need to keep in mind. One group is mainly transmitted through blood and body fluid, and that is hepatitis B and C. And then the other group, hepatitis A and E, is most of the time caused by infected, and contaminated water and food which we drink. So these two group of viruses are the problem which really cause liver disease. Although all of them have got slightly different spectrum of liver disease they cause, but we must know that these are the viruses which we can get into our system, and that can lead to liver damage.
Now, when it comes on to these medical conditions, what are the steps that people can take to protect themselves? And then we can move on to treatment and transplant later.
So as your question you have asked me, I think first I'll go with the prevention and then coming back to the treatment. There are a lot of preventive stuff, and these are very common things which everybody should know about it, and we should follow that. As we discussed earlier, one of the disease which is becoming very very common is non-alcoholic fatty liver disease, and the main problem there is excess deposition of fat. That means leading a healthy lifestyle, and that includes healthy eating as well as good rate of exercise to keep yourself fit and not to get into overweight, obesity and things like that. That's going to go a long way to prevent many of the liver disease, including NASH and NASH related cirrhosis. The other aspect which we need to remember and which is avoidable is about the viral liver disease. So you need to remember that now there are vaccines. There are vaccine for hepatitis B, there are vaccine for hepatitis A. So you must get vaccinated, and once you are vaccinated, you cannot have this kind of hepatitis virus. So at least those vaccines which are available for hepatitis A and hepatitis B, we should take, and especially certain group of people like us, which are in healthcare industry, they must have. So these two are the common way, healthy living and required vaccination can go a long way to prevent liver disease. And third, which I must emphasize, is alcoholic liver disease. So, you know, alcohol is dangerous. We know that. And so many people are getting affected with alcoholic liver disease. So people need to know that alcohol can cause serious liver damage.
And then if you have someone who has serious liver damage, what options are there to treat them? What would you do? What's available?
So there are a lot of things which has happened in last decade in improvement in treatment of liver disease. Now let's talk about the hepatitis. The viral hepatitis. Now there are new direct acting antiviral agents. So when the disease like hepatitis B was difficult to treat, hepatitis C was almost impossible to treat, and the disease will recur even after treatment. Treatment was difficult, complex. There was a lot of side effects, and suddenly all these things have changed. So now for hepatitis B and hepatitis C, there are such wonderful medicines which you take once in a day, and the virus just disappears in few months. So there are a lot of advances which has happened, and similarly, there are other fields of liver damage as well, where their medicines have come up. We now know how to use the medicines better, and as far as the tumors are concerned, the surgical techniques has developed. We know how to treat those tumors. There are non-surgical aspects. There are chemotherapies. There are immunotherapies. A lot of things has developed in last decade in field of treatment of liver disease.
And are there any new innovations or medical treatments that you're most excited about that will help people in the future with these diseases?
So one thing, which which must discuss, especially for the population to know about the liver transplantation. Liver transplantation is not new. Definitely, it's going on for years, and even in India, we are doing a lot of liver transplantation in last at least in last decade. It has picked up. So liver transplantation is a fantastic option for the patients who are in end-stage liver disease, whether it's acute liver failure, which we discussed, or whether it's decompensated kind of cirrhosis. And liver transplantation also has moved. The result of liver transplantation has significantly become better. New immunosuppressive agents which has come into the market, and they are much more safe compared to the previous immunosuppression. And other than that, there are a lot of other interesting research which is going on in the field of liver. And one of them is basically everywhere people are trying to find out how we can replace liver with some kind of artificial device. Like you have got dialysis for the kidney disease. Similarly, a lot of research is going on liver regenerative therapy, either using certain kind of cells which can finally form into hepatocytes. So that one kind of research which is going on. Then the other kind of research is going on where you can design some kind of filtration mechanism where at least the excretory function of the liver can be taken care of. So there are a lot of research is going on in forming an artificial liver, whether using biotechnology, whether taking advantages of liver cells itself, which can regenerate over a scaffolding, forming a artificial liver. So this liver regeneration and liver replacement therapy is a very, very interesting area of research.
And if there was one takeaway message that you would like people to remember, what would it be?
Yeah, I think it has been a really good discussion. I would like to say a few very important things which we need to remember. Everybody should remember that a lot of liver disease can be avoided if we take certain precautions. So first thing to remember is that we should get vaccinated against hepatitis A and B. So that becomes a preventable disease. And the second thing is it's all about quality of the life which we lead. So if you eat healthy food, if you remain fit, if you do not allow yourself to go into overweight and obese category, the liver disease like NASH, which is spreading like wildfire all over the body, can be controlled. So live healthy, eat healthy, and get vaccinated against certain liver disease, which vaccines is available everywhere. Okay, that's I think is the final message which you'd like the patient to to consider.
Well, thank you for your time. Thank you for joining us. And we hope that you will join us next time as well for more insights into liver damage, liver cancer, and the treatments available.
Okay, so thank you, Rajan. It was, I think, a very useful discussion we had, and we will continue discussing the important topics related to hepatobiliary surgery. So probably next time, when we come together, we must discuss about the liver cancers. Thank you, and bye bye.
Thank you.